May is Brain Tumor Awareness Month. 25,000 people in the U.S. are diagnosed with a cancerous brain tumor each year.
The most common brain tumors actually don't start in the brain.
Dr. Jean Barnett is director of Cleveland Clinic's Brain Tumor and Neuro-Oncology Center.
They are cancers from the lung, breast, kidneys, melanoma, colon, that spread by the bloodstream to the brain. The symptoms of a brain tumor, for the most part, are very similar to the symptoms of a stroke: difficulty speaking, weakness or numbness on one side of the body, difficulty with peripheral vision, those kind of things. But instead of being abrupt, like in a stroke, they are progressively gradual. And that also, two other symptoms are seizures and headaches. Actually, headaches are comparatively rare, but when you get headaches from a brain tumor, typically you wake up with them in the morning and they get better as the day goes on. Brain tumors increase with age. So the older you are, the more likely you are to get a primary or metastatic brain tumor. But brain tumors occur in kids. I think it's one of the highest causes of child death in the U.S. are brain tumors. It's not uncommon to diagnose certain brain tumors accidentally, particularly meningiomas, which are characteristically slow-growing tumors that are benign of the membranes that line the skull. And these can actually get very large before they cause symptoms because they grow so slowly, which allows the brain to get out of the way.
The treatment of brain tumors has improved.
We're really good at taking care of brain metastases these days. 20 years ago, the whole brain would have been radiated over 10 sessions, and then people would get demented, lose their memory, and so on. But now we do radiosurgery, which is a targeted radiation treatment where the rest of the head and brain gets almost none. We use something called the gamma knife for that here at the clinic. We have 2 of those. On the other hand, primary brain tumors such as glioblastoma, which is the most common malignant tumor of the brain, we're still not very good at getting long-term control in most people.
Vaccines and immunotherapies are also being studied.
So besides those, there's something called low-intensity focused ultrasound. Most chemotherapies cannot get into the brain because of something called the blood-brain barrier, which is there to protect us from noxious things in the environment. But it also protects the tumor from the chemotherapy. By using low-intensity focused ultrasound, we can actually open that barrier and allow those chemotherapies to get in. And this has shown some very promising results in recent clinical trials. It has not reached the point again where it's a standard therapy, but it may become that in the next 5 to 10 years.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.